Good evening, guys. I have discussion C for you tonight. Let me get set up for the show, and I'll be right with you, please. Okay, tonight's discussion C deals with a thyroid medication, levothyroxine, and bone loss. Key findings from a recent study presented by Radiology Society of North America, RSNA, suggests a potential link between the widely prescribed thyroid medication levothyroxine, commonly known as Synthroid, and bone loss in older adults. Study overview. Population studied: 81 levothyroxine users versus 364 non-users, mostly in their 70s. Duration, median follow-up of 6.3 years. Findings: users of levothyroxine showed decreased bone mass and density. The bone loss occurred even when patients followed current treatment guidelines. Okay, give me 1 second. Expert commentary. Dr. Shadpour Demari, co-senior author, emphasized that findings suggest a concerning trend in older adults, even under guideline compliant use. However, Dr. Yalada Safari cautioned against over-interpreting the results. The study had a small sample size, limiting its statistical strength. It showed correlation, not causation. Hypothyroidism itself may contribute to bone loss. She stressed the need for larger scale research before altering prescribing policies. Implications for healthcare. This study raises important questions for clinicians and patients. Should bone health monitoring become routine for older adults on levothyroxine? Could dosage adjustments or alternative therapies mitigate risks? Do we balance thyroid regulation with long-term skeletal integrity? Given your expertise in frailty-aware care and collagen integrity, this could be a compelling case for integrating bone health assessments into personalized thyroid treatment plans. Would you be interested in exploring how smart housing or predictive algorithms might help monitor such risks in elder care environments? Absolutely. Here's a simplified breakdown of the key findings. From the study on levothyroxine and bone loss. What the study looked at: researchers compared 81 people taking levothyroxine, a thyroid medication, with 364 people not taking it. Most participants were in their 70s and they were followed for about 6 years. What they found: people on levothyroxine had weaker bones, less bone mass and density. This bone loss happened even when they were taking the medication correctly, according to current guidelines. What experts say: one doctor said, this is worrying for older adults, even when the drug is used properly. Other experts warned not to jump into conclusions. The study was small, so results aren't definitive. It shows a link, not proof that the drug causes bone loss. More research is needed before changing how the drug is prescribed. Why it matters: doctors might need to watch bone health more closely in older patients taking levothyroxine. It raises questions like, should doses be adjusted? Are there safer alternatives? How do we protect bones while treating thyroid issues? Would you like to explore how this could influence frailty-aware care models or smart housing designs that track bone health over time? Certainly. Frailty-aware care models are designed to support older adults whose physical and cognitive resilience may be reduced. These models aim to prevent complications, personalize treatment, and enhance quality of life. Here are some practical examples. Comprehensive geriatric assessment. What it is: a multi-dimensional evaluation covering medical, psychological, functional, and social domains. It helps identifies frailty early and tailors interventions like physical therapy, nutrition plans, or medication adjustments. Example: a hospital uses CGA before surgery to decide if an older patient needs pre-rehabilitation or alternative treatments. Okay. Um, Example 2: memory friendly housing with embedded monitoring. What it is: smart homes equipped with sensors and assistive tech to monitor mobility, sleep, and medication adherence. How it helps detects early signs of frailty, e.g., slower walking speed, missed meds, and alerts caregivers. Example: a senior living facility integrates fall detection and cognitive prompts to support autonomy while reducing risks. Number 3: shared decision making frameworks. What it is: collaborative care planning that includes the patient, family, and care team. How it helps: aligns with aligns treatment with the patient's values, especially when balancing risks like bone loss versus thyroid regulation. Example: a clinician discusses levothyroxine risks with a frail patient and explores bone strengthening strategies before adjusting dosage. Therapeutic integration in a day programs in like adult adult daycare, folks. Therapeutic integration in day programs. What it is: adult daycare centers offering tailored activities like dance therapy, mindfulness, and strength training. It helps build resilience and reduces frailty progression through social engagement and physical stimulation. Example: program tracks improvements in gait and cognition after 12 weeks of integrative therapy. Predict uh, Predictive algorithms for risks satisfaction. What it is: AI driven tools that analyze health data to forecast frailty related decline. How it helps. Enables predictive, proactive interventions like bone scans or dietary changes before symptoms worsen. Example, a care platform flags a patient on levothyroxine as high risks for osteoporosis and recommends early DEXA screening. Would you like to dive deeper into how these models could be adapted for thyroid related bone health monitoring or integrated into smart housing environments? Absolutely. Here's a detailed breakdown of the comprehensive geriatric assessment, okay, which is CGA for those who don't understand. Um, Cornerstone of frailty aware care. Now, guys, that's what we use to determine um, how far a person's bones become frail, and to what degree their bones have bone loss or whatever. So those are the testing that we use. Okay. Comprehensive Geriatric Assessment, or CGA, a deeper dive. A deep dive. CGA is a multidimensional, interdisciplinary diagnostic process designed to evaluate an older adult's medical, psychological, functional, and social capabilities. Its goal is to develop a coordinated and personalized care plan that improves outcomes and preserves autonomy. Okay, core domains assessed. Domain, what what's evaluated, why it matters. Medical, chronic conditions, medications, sensory impairments, identifies polypharmacy risks, and unmanaged diseases. Okay, guys, that assessment gives us a clearer picture when a person shows up in front of us. Gives us a better detail of what they need, and what how to prioritize their care first. What are the most pressing priorities for their care when it comes to seniors and having bone issues. Functional activities of daily living, or ADLs. Mobility fall risks, determines independence level, and need support. Now, like I said, it determines how much a person needs a support also, but it also depends on what their bone density scale numbers are. How prone are they to fractures, how prone are they to falls, things of that nature. So those are very important to have done for seniors. Let's see where we were. Cognitive memory, attention, executive function, screens for dementia, delirium, or mild cognitive impairment. Psychological Okay, this also screens for depression, anxiety, coping mechanisms, addresses mental health and emotional resilience, social living situation, caregiver support, finances, uncovers isolation, neglect, or resource gaps, environmental home safety, accessibility, hazards, guidelines, modifications to reduce injury and promote autonomy. Okay, tools commonly used. Give me 1 second, guys. Paper's giving me a hard time here. Two. Okay, next page. Now, this one explains the mini mental state exam. Or okay, this one explains the mini mental state exam or MOCA for cognition. This one also uncovers geriatric depression scale or GDS for mood, timed up and go or TU or tug, for mobility, barrel index or CATS index for ADLs, medication review for polypharmacy and interactions. 3. Interdisciplinary team involvement. Geriatrician oversees medical management, nurse coordinates care and monitors daily function. Social worker assesses social needs and resources. Physical occupational therapist evaluates mobility and home safety. So when we do those things for elderly care, we all collaborate. It's a big collaboration to do somebody's assessment for the right kind of care. Those are important, folks. Those get people the the geriatric assessments get people tailored care. What I mean by that is it gives us a big picture window as to what they need for services. You know, you can take a person, let's say, for example, you take a person that goes into a hospital, um, which is, this person goes into the hospital for, maybe surgery, comes out, but they're not, they've had an issue happen like a stroke, while being in the hospital or something. But they go in as a normal person, but they come out with functional disabilities. Then our job as geriatric people is to take that person and break the assessment down into detail, into each part has to have a certain amount of detail so that we have a bigger picture as to how to plug in services for their care. All right, so those are what geriatric assessments are for. All right, so we're down to interdisciplinary team involvement. Last one we were at was physical occupational therapist evaluates mobility and home safety. Okay, pharmacist reviews medication for safety and effectiveness. Okay, then we also, if the person is having meal plan issues or eating problems eating, we add a dietitian into the whole mix of things to tailor like a diet for them or eating an eating routine. Okay, so I'm gonna go through that section for you also tonight. Okay, let's see. Dietitian advises on nutrition, especially for bone and brain health. Okay, outcomes and outcomes and benefits. That's number 4. Personalized care plans that reflect the patient's goals and frailty status. Reduced hospitalizations and institutionalization. Improves medication safety and adherence. Enhances quality of life and functional independence. Application to levothyroxine and bone health. And in the content of the levothyroxine study, CGA could flag bone density concerns early in thyroid patients. It allows for adjusted dosing, DEXA scans, and fall prevention strategies. Integrating CGA into smart housing or predictive algorithms could automate alerts when frailty markers shift. Would you like to explore how CGA could be adapted for memory friendly housing or integrated into caregiving training programs? Great question. The comprehensive geriatric assessment CGA offers a range of benefits that make it a powerful tool in frailty aware care. Here's a clear breakdown. Okay, I'm going to go through each part of the assessment for you and explain it. Okay. Okay, key benefits of comprehensive geriatric assessments. Number 1, personalized care planning. Tailors interventions to individuals' medical, functional, and cognitive and social needs. Aligns treatment with patients' goals and values, especially important in complex cases like balancing thyroid treatment with bone health risks. Okay, 2, for reasons. early detection of fall of early detection of frailty and risk factors, identifies subtle declines in mobility, cognition, and or nutrition before they lead to serious complications. Enables proactive strategies like fall prevention, bone density monitoring, or medication adjustments. Improve clinical outcomes, reduces hospital admissions, emergency visits, and institutionalization, enhances recovery rates, and minimizes adverse drug reactions through careful medication review, enhanced communication, and shared decision making, facilitates collaboration among patients, families, and interdisciplinary teams, builds trust, and ensures care decisions reflect the patient's preferences and life contexts. Five, support for independence and quality of life. Promotes autonomy by identifying supports that maintain daily functioning. Okay. Encourages therapeutic activities and environmental modifications that preserve dignity and engagement. Six, data driven insights for long term planning. Generates a holistic health profile that can be integrated into smart housing systems or predictive algorithms. Useful for useful for tracking changes over time and adjusting care dynamically. In the context of levothyroxine and bone loss, CGA could be instrumental in flagging bone health vulnerabilities early, customizing thyroid treatment to minimize skeletal risks, embedding alerts into smart environments for real time monitoring. Would you like to explore how CGA protocols could be adapted for use in memory friendly housing or caregiver training models? Thanks for asking. In a comprehensive geriatric assessment, CGA, clinicians use a variety of validated tools to evaluate different aspects of an older adult's health. Here's a breakdown of the most commonly used ones. Key tools in key tools used in CGA: cognitive function, tool purpose, many mental state examination, screens for dementia and cognitive impairment, Montreal Cognitive Assessment, or MOCA, detects mild cognitive impairment with more sensitivity. Clock, uh, clock drawing tests assesses executive function and visuospatial skills, psychological health, tool purpose, geriatric depression scale, or GDS, screens for depression in older adults, hospital anxiety and depression scale, or HADS, evaluates anxiety and depression symptoms. Physical function and mobility, tool purpose, timed up and go, or TUG, that's TUG, assessments mobility, or assesses mobility and fall risk, short physical performance, battery, or SPPB, measures balance, gait, speed, and lower body strength, grip, strength test, evaluates muscle strength, a key frailty marker. Activities of daily living, tool purpose. That's where we use the CADS index. Independence in ADLs assesses basic self-care abilities, bathing, dressing, okay. Lawton instrumental ADL skill evaluates more complex tasks like cooking, managing finances, medication review, tool purpose. Beer's criteria identifies potentially inappropriate medications or for older adults. Stop/start criteria flags risky prescriptions and suggests beneficial ones. Nutrition, tool purpose, many nutritional assessment screens for malnutrition and dietary risks. BMI and weight tracking monitors changes that may signal frailty or illness. Environmental social assessment, tool purpose, home safety checklist, identifies fall hazards and accessibility issues. Social support inventory evaluates caregiver availability and social engagement. These tools work together to create a holistic picture of patients' health, guiding personalized interventions. Would you like to explore how these tools could be digitized or embedded into smart housing systems for real-time frailty monitoring? Okay, guys, so C is the last one for tonight. I will see you guys for tomorrow's shows. Until then, Gator Wellness, take care, folks. And like I always say at the end of the show, if anybody has any show ideas, comments, things they want me to look into, leave it in the chat below for me. And I will see what I can do about getting you answers on the show for now. For now, Gator Wellness, take care, folks. Have a good evening.